Hello, my dear friends. This is Dr. Charles from PHI Preventive Health Institute, where we share practical lessons drawn from real cases we see every day. Behind every symptom is a real story, and today's topic highlights something many people misunderstand about stomach ulcer treatment. Relief is not the same as cure, because in many cases, the burning pain is not just caused by acid. It is driven by an infection quietly surviving underneath. And when treatment is incomplete, the symptoms often return. They often return stronger and harder to treat. That is why we approach it from 4 key perspectives: what the doctor evaluates, what the nurse manages, what the pharmacist safeguards, and what the dietitian supports. Today we are looking at this through the pharmacist perspective. In real life, ulcer symptoms rarely begin dramatically. A burning pain in the upper abdomen, bloating after meals, nausea, discomfort that improves briefly after eating. At first, it feels manageable. An antacid is taken. Spicy food is avoided. Something is used to calm the stomach, and temporarily the symptoms improve. But then the pattern returns more frequently, more persistently, and that is where the real issue begins. Because for many patients, the problem is not just excess acid, it is Helicobacter pylori infection, a bacterium living inside the stomach lining. This infection cannot be treated with symptom relief alone. It requires structured combination treatment. So the system becomes infection, irritates the stomach lining, inflammation develops, acid worsens the injury, and symptoms appear. Then treatment begins. Antibiotics target the bacteria. Acid suppression supports healing, and symptoms improve. But when treatment becomes inconsistent, the pattern shifts again. Symptoms improve early and doses are missed. Treatment stops halfway, the bacteria survive, and symptoms return. Not because the medicines failed, but because the infection was never fully cleared. Now look at what is commonly used. Treatment often combines 2 antibiotics with an acid-reducing medicine. Amoxicillin and clarithromycin help eliminate the bacteria. Omeprazole reduces acid and allows the stomach lining to heal. Each medicine has a separate role, but the treatment only works properly when every part is taken consistently together. This is what often happens. After a few days, the stomach pain settles, appetite improves, the burning reduces. The assumption becomes, I'm okay now. Then doses are skipped, one antibiotic is stopped, treatment becomes irregular, and slowly the system becomes unstable. The bacteria adapt. The infection persists underneath. Symptoms eventually return, and future treatment becomes more difficult. Some patients continue using anti-inflammatory painkillers like ibuprofen during treatment. So while one medicine is trying to heal the tissue, another may continue damaging it. While one medicine is trying to heal the tissue, another may continue damaging it. That is why medication coordination matters. So the first step is clarity. What is each medication doing? Antibiotics eliminate infection. Omeprazole supports healing. Then comes consistency. Take every dose exactly as prescribed. Complete the full antibiotic course. Do not stop early. Avoid unnecessary painkillers and report side effects early instead of abandoning treatment. Incomplete treatment breaks the system. When treatment is completed properly, the outcome changes. Better healing, successful eradication, and lower long-term risk. H. pylori treatment is not just about relieving pain. It is about fully clearing the infection before complications develop. If you have persistent burning, stomach pain, recurrent ulcer symptoms, or difficulty completing your medications because of side effects, seek proper medical or pharmaceutical review, or call/WhatsApp +233 2087 20347. And remember to explore the other 3 perspectives because each one completes the picture.